Welcome back to Wellness Wave Radio. Thanks for tuning in this morning to ride the wave with us. Each week our goal is to give you at least one suggestion that will make your life a little better. My name is Phil George. I'm a clinical biochemist, a certified personal trainer, and a health coach. Please remember that everything we discuss in the show is for informational purposes only and should not be taken as medical advice. So we're going to be doing a lot of medical talking today. I'm here with Dr. Nurse Emily, Dr. Emily Nurse. So Emily, why don't you introduce yourself? Tell us a little bit about yourself and your credentials.
Sure. Thank you so much for having me here. You have that whole thing memorized, huh?
Like Teddy Rupp can just.
Yeah.
Do you remember that show, that movie Ted?
Yeah.
Okay.
Yeah.
Remember when Ted?
Marky Mark was on that. Was
Yes.
that? Yeah.
Yeah, Marky Mark.
Yeah.
So what happened is, you remember when with Ted, they were trying to get him whether he was a real person or not? Remember?
Yes.
Okay.
Yes.
So the lawyer going against them, because he was made at Hasbro in Rhode Island, right? And he said, okay, Ted, press your belly button. And he would say, I love you.
Do you feel like you're saying that every time you have this show?
So you could wake me up at 2 in the morning and I'm the Teddy Rupskin. I'll just press my belly button.
Oh my gosh, that's so funny. Well, I am Emily Cabrera. I am a registered nurse who went back to school for numerous degrees and eventually earned my doctorate in education. So that's where the doctor comes from. And then I went back to school again for my 7th degree. I just kept on going because I like to be a lifelong learner and I wanted to keep my student loans in forbearance. But I also enjoyed what I was doing. And I went back to school again to be a psychiatric mental health nurse practitioner. So that's what I do now. So I am Dr. Emily Cabrera, with doctorate in education, master's in nursing education, registered nurse, and psychiatric mental health nurse practitioner. And did you know that I was a legal nurse consultant also?
Whoa. And weren't you also a dental hygienist?
And my first career was as a dental hygienist with my pearly whites. My grandmother said to me, you are going to get, my grandmother's generation didn't work, right? So they had 6 kids. My mom was one of 6. And all of us grandkids, but especially me because I was the oldest granddaughter, she said to me, you will have a career where you can support yourself. You have 2 uncles that are dentists. They work their way up to being an orthodontist and just a general dentist. And she said to me, you're going to be a dental hygienist. I will give you $500, and if you do not be a dental hygienist, I'm not going to give you any money. I said, okay, I'll be a dental hygienist. And I hated it. I hated sitting in a chair.
Yeah,
so
it's funny because
what
I've said before, when I usually introduce Emily, I'll say she has more degrees than a thermometer. And then her response is, yeah, I have the student debt to prove it.
Yes.
she has it. But the other thing, I got to tell you, Emily, I haven't said this to you before in private.
Okay.
But out of the 3 years I've been doing the show, you have more degrees than anybody, and I've had a lot of medical professionals. So you win the prize.
Yay! Yeah, but you know what? Like with every degree, it was purposeful. So like there are some people who just stay in school and they have no awareness of what's going around them, and they just have all these credentials, and you talk to them and you're like, who are you? Like there's no way to relate to that person. They don't have critical thinking. I like to think that I'm not that person. With every degree I got was very purposeful. I wanted to get a different job or have more work-life balance or the knowledge to support what I wanted to do. And eventually here I am. And I'm doing what I want to do.
Yeah, and I think one of the things that really makes you so valuable, especially to clients, because in fact I'm meant to do this. This is on yesterday's paper, and it says diagnosis frustration, and it's saying doctors are really getting frustrated. Anybody who's had to deal with the allopathic, the Western medicine lately, extremely frustrating. And you had given me some numbers. It's basically, they got about, 8-10 minutes to see you. It's called diagnose and adios. Get you in, get you out. Other thing a lot of people don't know is back when I was a kid, when the dinosaurs ruled the earth.
Oh, Lord.
So what happened is you see the doctor. I was actually at the Greendale Y. We were going to do stuff at the Greendale Y, and I brought this up, and one of the women, she said, yeah, when the dinosaur ruled the earth when I was a kid, she said, yeah, the doctors used to actually come to the house. Oh my God, they actually came to the house. The old Marcus Welby thing, with it. But now it's so industrialized now. a lot of people don't realize, but most physicians are actually employees of the hospital. They're on salary. In other words, they're going to do what they're told because they're an employee. And the insurance companies are going, going back on them. And also the MBA at Harvard is talking to them, telling them you just need to see more patients and things like that. The other problem is you get so many specialties and subspecialties. So I go see one doctor and he's the primary care and I get a rash. I go to see the dermatologist. The dermatologist says, well, I don't know if that's a rash. Maybe you need to see the immunologist. So you're going from here to there and nobody's looking at the big picture. Is there really something else going on? So one of the things that Emily, you correct me if I'm wrong, you can offer, you have a lot of different things. They call it holistic or functional. Can you tell us a little bit the difference between allopathic Western medicine and a functional or holistic practitioner?
Sure. So this is based off of some of my opinion, but also what I've witnessed as a nurse within healthcare, and then also just fact, like what's out there in the research and how business models, hospitals, clinics, anything that's really funded by insurance motives, right, is a business, period. They're in it to make money. It's a matter of which philosophy or which job or whatever you identify with. That's the type of job that you're going to get. But that's Western medicine. So Western medicine is heavily grounded in treating the symptoms and not actually the root cause. That is not personal. So I would say every healthcare provider that I know, personally, professionally, they go in for a really good reason. They want to help people, and they have this pure, intention to give great service through the interventions that they've been trained on, and then they quickly realize, sometimes before it's too late, and they can't change to a different job or go into their own private practice, they quickly realize that, that idea that you're going to make that change through the model that they have is not realistic. So, the interventions that they provide with a client, if they are with that person for 15 minutes because they have to keep seeing patients, and the wait list is so long, we have to get to providing this help. You have 15 minutes. That is literally me going into Dunkin' Donuts and ordering a coffee, standing in line for 3 people in front of me. How do you give good interventions that way? So now cross over to Eastern medicine or a combination of Western and Eastern. You have like this functional integrative medicine, and the goal is to really provide whole body support. And you do that through, a lot of times, removing yourself from that business model. And you wind up being private pay, often. Some insurances will pay for some of those, acupuncture, massage therapy, chiropractor, some naturopathic. But again, it's out of network. They might reimburse you. You might have only a certain number of appointments that they can be seen in a year. Okay, if I'm going to take my mom, for example. She was a nurse and had horrible foot pain because back then she worked in the emergency room and she wore sneakers that probably weren't the best support and caused neuropathic pain in her feet. She was not a diabetic. This was literally related to her job. When you're pounding the pavement, going back and forth on the unit or in the emergency room with not the best shoes on concrete floors, you have, what's the word I'm thinking of? Like, you're going to have damage to your nerves. It's going to happen. You don't have good support under your soles. So being seen by an acupuncturist did a really great job for her. Yeah, well, they would only cover like 6 visits a year. How does that help her when she needs it once a month? Do you know what I mean? So there's like this conundrum in medicine. Do you provide the help that you really want to do, but you don't have the support financially and backed by your job in order to provide that care? So some people just say, screw it, done. I'm going to go out on my own private practice and I'm going to take over my vision and implement, and you see a lot of that integrative functional medicine happening through that. Sometimes if you work in like fabulous cities like Boston, they might have some of those services as part of their big business. Like MGH has fabulous naturopathic services, but you better have a really good insurance in order to cover it.
Right, and I
Tough.
think the other thing is, and we talked before the show, and one of the issues is, if really your health is the most important thing. We talk about this over and over again. I like to say basically your two most valuable assets other than your family is time. Time is the ultimate currency. We only have so much of it. And number two is your health. And I think health is even more important because if your health is lousy, then one of the problems is you maybe wish you had less time because that's why people that's why they have right now euthanasia is that I'm in constant pain. I can't deal with it anymore. I'm gonna go down to Portland, and I'm just gonna end it all. So, but again, you don't get sick usually overnight. Even this is a long process. So all of a sudden it's coming. So you want to catch it. You want to catch it ahead of time. And what you said, Emily, is what they call what's the root cause. Okay.
And that's being proactive, not reactive. Western medicine is very reactive versus proactive, which is more of that functional, integrative, naturopathic, holistic medicine.
Right. It's interesting because what we talked a lot before about the carotid arteries and how they get clogged up. And the analogy is you got a hose and you're all of a sudden it gets less and less. You got all the calcium and stuff built up in there, and you got a problem. Then it's kind of coming out. You got a bigger problem if it's in your carotid arteries. So, but you don't know that. In fact, I had a caller onto my show, and I think Art said that the station manager said it's okay to mention him. He had 90% blockage in his arteries. So this particular guy called my show on WCRN, and he said, I had some DVTs, deep vein thrombosis, but they never checked his carotids. Let's check your carotids. 90% rushed him into surgery and cleaned him out. So what happened?
So that's a great example. There are reasons for insurance, and we need those services. 100%. It is irrational to think that we can have an all or nothing approach, right? Like sometimes when you start talking about private pay or that insurance conundrum, you go down these roads where people think that you have to be all or nothing. There is a time and a place to have those services. We just want to focus on proactive, right?
The other thing I liked, my sister, the other psychiatric nurse, said this to me, it's good, is Western medicine is really good for what they call acute care. You break your leg, you got to go in there, you got a heart, hey, go in. We're fantastic, probably maybe the best in the world, or one of the best in the world. For chronic conditions, we're awful. We're awful because what happens, the other thing, I think one of the things that Emily does, and I try to do also, is to stop it before it happens. Again, we had the Vascular Care Group as a sponsor of my show, and I know Dr. Eddie Roos very well, and he does a phenomenal job. But you know what? The average person is not going to go into a vascular surgeon and say, how am I doing? Should I do something? They're not going to.
They'd be out of business.
You're only going to go in to see the cardiologist or the vascular surgeon if you've got a problem.
Yeah.
So kind of like Emily's job and my job is try to stop you before you go in to see them. And that's the whole thing. So let's find out, through lab work, through tests, what is something called your high sensitive C-reactive protein, a measure of chronic inflammation. This causes so many problems, but a lot of doctors don't check on that. So all of a sudden, the number one complaint I hear most doctors have is I've got no energy, or I have aches and pain all over the place.
Tons of that happens in mental health. So, okay, depressed. Let's give you an SSRI. Like that is the 15-minute appointment. And then to add on to it, this is not a dig. All the doctors out there, I love you. I have lots of friends. I've needed to use you as my own practitioner. This is not a dig. But if you don't know what you're doing, then you resort to what you think is safe, right? Like the intent is to not cause harm. But we shouldn't be putting people on SSRIs after a 15-minute appointment because you think that that's a good decision when you don't really know the background with it.
You don't-
let's
you-
look at your nutrition.
You don't know the
stress.
you don't know the root you don't know the root cause.
Yes.
So for the listeners,
Yes.
Serotonin is the feel good.
Yeah.
So in other words, one of the causes of depression is basically not enough serotonin in the brain. So what an SSRI does is your neurons give off a little bit of serotonin, and then it sucks it back in again. So what the SSRIs do, it prevents it from so it keeps more serotonin in the brain. But they've done studies and they found out the majority of serotonin is made in your gut, and it goes up your vagal nerve. So you could have what's called dysbiosis. Nothing to do with your brain. It could be you could mess up with your gut, and that's something Emily can figure out. Is it your gut or is it your brain? What's really the root cause?
It's just taking the time to talk with people sometimes. Like finding out maybe this is stress. Maybe there is a genetic component to it. There's so many different reasons, and even a half an hour appointment is not enough. And many people within that Western model, they just don't have time to spend with their clients and really figuring out some of these tests and conversations and guided questions that especially in mental health, a person will not tell you stuff that's going on if they don't trust you. And trust is part of an established relationship. So it takes time. Some counseling, when I was doing my counseling hours and own counseling, it might take me 6 months to get to a trusting relationship with a client in order for them to really start to even tell me what the underlying issue is mentally. 6 months, we have nothing that's productive, quote unquote productive. And we're just, chit-chatting and how are things going? But then month 7, they drop the bomb on you. And you're like, oh, now we can get to work, let's help. But that could never have happened if we hadn't met for 6 months. They showed up to their appointments. We established a relationship. How are you going to have that? A doctor would, or someone who's in that environment, primary care type deal, their eye would be twitching after 20 minutes, and you're like, just get to the point. I don't have time for this. I got 4 other people waiting.
Plus, the other thing that happens, a lot of time you may see that doctor, but you may wind up seeing the nurse practitioner and this
Who's
person.
probably better because they can take more time.
But you're not seeing. They don't know you as. They don't know you as a person.
Yes.
That's a whole different. That's a whole different different ball game. But I'm going to take issue with something you just said.
Okay, say it. This is
take,
good conversation.
They would take 6 months to trust you.
They might.
No, because I trusted. We met and we spoke for 3 hours.
I know.
And the whole of it is, I don't know. I have a pretty good sense I can trust somebody or not, and we really hit it off. In terms of talking. So, Emily on my end is extremely trustworthy, and you can tell because most language is nonverbal. Other thing, it's the facial expressions and everything else. So if you see Emily, I'm going to promise you, you're going to trust her almost instantly. If you don't trust her already, you can see. But that's the whole thing. I think it's just the thing. And they looked at malpractice suits, and they found out
Trust.
Yes. It wasn't.
They will not sue you if they trust you.
If they like you, it's
no matter what happened.
That's right. It's not that you didn't make a mistake. It's that. But you know what? You're a good person. I trust you. And everybody makes a mistake. But that's the whole thing. So trust is so. But the other thing, one of the things, I recommend Emily is you're not only getting, sometimes you see a therapist, the therapist, that's their thing, is the mental stuff, the Freudian things or whatever. But Emily's also has the whole metabolic part of it. So she's going to be able to look at the whole thing. So you don't have to get a different therapist and a different health coach and a different this and a different that. It's one-stop shopping. So it's kind of like you can just meet with Emily, and Emily's going to be able to look at all the different pieces of the puzzle. Because the other thing I like is, you know what actually makes the best physicians or nurse practitioners come out of school on undergrad? Any guesses?
What?
Engineers.
Oh, they're methodical. They want to get to that root cause.
What's the problem? How do we solve the problem? So really what Emily and I are, we're medical detectives.
Yeah.
Here's the problem. What's the root cause of the problem?
When I was in nurse practitioner school, my preceptor, who is amazing, she told me some really great advice. So my nursing experience, my bedside experience has always been adult critical care. When you said Western medicine is great for acute care, you hit it right on the nail. We will keep you alive by all means necessary. Which actually led to a lot of my burnout and my moral distress, right? Like, some people, that's not in their best interest. We'll just say that. When you see so much dysfunction and pain and suffering because we're keeping people alive, we're nicer to our pets than we are with some of our people, right? But we're great at that. But anyhow, acute care and trying to, keep people together, there is a time and place for that. You have to solve things right then and there. A lot of mental health, you're in it for the marathon. You are in it to help them. So my preceptor said, you don't need to think that you need to cure the person, whatever cure means, but you don't need to do those interventions with one appointment. Your goal is to do this over time. So like, if you come see me, which I hope you do, we're going to have a conversation about, okay, well, why are you here? A full, thorough, comprehensive intake. I ask you a lot of questions. Answer questions that you feel are appropriate. You might not want to disclose some sexual trauma or something that happened to you in the past. We'll get to that. No big deal. We'll get to that, right? Like 6 months from now. But I'm also going to ask you about your nutrition. I'm also going to ask you about I said that like in 2 words. I slurred all those words together. Nutrition, and are you taking a multiple vitamin? And what is the stress in your life? I had thyroid cancer. 100%, I think it was due to the stress that was in my life. 100%. You talked about like inflammatory processes in your body. I want to check a SED rate and a CRP. Those are 2 serum levels that I can check. Maybe it's an autoimmune dysfunction and not necessarily a mental health. Maybe this is with your gut. Like, we're going to have those conversations. That happens through an hour and a half appointment. And even beyond that, I might call you. I don't have to prescribe that SSRI right now because I need to think things through. So for me, in my practice, and people that agree to what I am saying, I would rather have 6 clients in a day and really give them fabulous care and come out even with expenses than see 40 clients in a day. 40 patients. We'll use the word client versus patients. Patients automatically assumes that you're not an advocate. You need them more than they need you.
Right. The other thing I find is you don't even have to have any kind of necessarily psychological issues.
Yeah, no. Yep.
I know a lot of extremely successful people that see therapists. I know, I'm not going to mention, I have 2 people that are really close to me, I know personally, and they told me that they're seeing it. And I was kind of shocked because you seem like you got all your yes, I can't say that on the air because you have all your stuff together, and you're seeing a therapist. Because the other thing, if you think about it, sometimes you need somebody that's objective, that doesn't have any horse in the race, whatever that expression is. A lot of extremely successful people, but again, if you're a really successful person, again, you may want to just bounce some stuff off of Emily. But Emily's not only going to take it from the psychological point of view. You're also going to take it from the metabolic point of view. Look at everything because maybe your stress is caused by the dysbiosis or by thyroid or whatever.
So I'm going to kind of go back a little bit. You just made a really great comment that you can see a person like myself, and there's lots of us out there. There's a handful, at least in my geographic region, that kind of buy into the same kind of business model practice that I do, which is private pay. But you mentioned about, you don't have to have a mental health issue in order to come see me. Like, I know my role and I know what I can do, and some of that is metabolic. Like, let's cut down to the root cause analysis. For insurance-driven practices, you cannot continue to see the nurse practitioner, the psychiatric mental health nurse practitioner, unless they have you on meds. So the second you don't need those meds, you can't see that person. Well, that stinks, right? Like, talk about being reactive. Okay, so when you now have another mental health crisis, now you can come see me.
As long as you put them on the meds.
As long as you put them on meds. Yep. And that is a huge frustration that many psychiatric mental health nurse practitioners who are in that insurance-driven model have, is that they can't continue to see their clients when they've established those relationships and, maybe right now. So a great example, you don't have to be on meds for the rest of your life. Perinatal mood disorders. Say you just had a baby, you have postpartum depression, DSM-5 has like all these, criteria around that. The goal is to not keep you on psychiatric medications like an SSRI, that's just one, for more than like a year. You shouldn't stay on those meds. This is a situational issue, and we want to make sure you're safe and you're not going to cause harm to your baby in the middle of the night because you're acting psychotic. Postpartum depression is a very serious thing. It can be a very serious thing, so we have to use our judgment. Should they be on a med? Should they not be on med? Maybe we need to do hormones. Maybe they need sleep. Here's my prescription. I need you to get a babysitter so that way you can have a nap. The 10 people that are telling you, I can help you, the grandparents and your neighbor and all these people who love you, say yes. The answer is yes. But, as a new mom, I don't need any help. I am the best thing for my children. You feel like you're less than if you're asking for that help and taking advantage of it. We're going to have a conversation about that. And that takes time,
Right, and I think the other thing, a good example, is they've done studies, and I used to say this all the time, and my sister, the psychiatric nurse, would correct me. And as I would say, she agreed, basically. They found out simply exercise is just as effective as an antidepressant.
Go out and take a walk, get some fresh air, get the sun, clear your mind, do belly breathing, do box breathing.
Oh, there's so much of breathing. I just want, that's the other thing is I used to say that, but then my sister would come back and say, well, but not for acute serious. But then I saw a study. I sent it to her. Also severe.
Yeah.
So the exercise kind of does everything.
Yeah.
So she could, Emily would just say, well, do this type of exercise. So again, so Emily's the medical detective. She's going to figure out, what can we do? Maybe the last recourse is medication. We can look at everything else first before that.
The other thing to really think about too with the insurance, I just keep going back to your article because I see it in my face, right? Like in my line of vision. But for the insurance versus private pay. So there are certain professions, healthcare is one of them, frontline workers, cops, military, they're another bubble. There are certain professions where if you have a mental health diagnosis, and if you're doing insurance, it will be in your record, promise you.
Oh, that's right.
There are some mental health diagnoses that you can't do that job. So then the people who have mental dysfunction, mental upset, mental imbalance in a certain period of the time, it doesn't mean that they're crazy and they're psychotic and they're going to be like that for the rest of their life. They just need it in that time or longer. If they have that on their record, they can get fired or they can't get that job. Military is classic for that. They put you through the grind to see if you have that. And that doesn't mean it's valid or not, right? So they don't care. You are a number, it is, and that's it. Cops, it's the same way. Frontline workers, ambulance, EMTs, paramedics, very similar. So having the confidentiality and the ability to protect your mental health so that way you can get help, that alone is worth it for some professions.
So we're coming up to the end of the show, Emily. So again, I think know it's on the screen, but why don't you give her again, how can they reach you?
Sure. So the name of my practice is Dual Minds Integrative Psychiatry. You can go to my website, www.dualmindspsychiatry. Did I say interactive? Did I just say interactive? Integrative. Dual Minds Integrative Psychiatry is the name of my business. www.dualmindspsychiatry.com or 508-233-8354.
Or if that's too much for you, philgeorge@charter.net. So just email me and I'll shoot it right over to Emily. Thanks so much for coming on, and we'll see you guys at the next show. Actually, Emily's going to be right after this for part 2.
Okay.
See you guys.